Okay, so Assalamu alaikum everyone. I guess you might all be really exhausted by now, but it would be a brief lecture and we'll get done by it very soon. We just need to talk about two drugs today, aspirin and the other one is acetaminophen. All right, aspirin is supposed to inhibit platelet aggregation, as you might all know, and acetaminophen is a very common over-the-counter painkiller, right? So we need to talk about the overdosages and what would be the sign and symptoms that we need to look for. Before going into that, we need to be aware of these terms, which are analgesics, which just mainly means a painkiller. That's it. All right. However, they do not induce sleep. Analgesics do not induce sleep. They just are simple painkillers. On the other hand, there are antipyretics, which just lowers the body temperatures, right? So the first one would be aspirin that we need to talk about. Now, whenever you think of aspirin, consider it to be an acid, all right? Because it has acidic properties to it. And the sign and symptoms that you're going to see would be related to the acidic properties that aspirin has, all right? So the main symptoms of overdose of aspirin would include dizziness or giddiness, tinnitus, which is buzzing in ears, facial edema, including the eyelids. There would be skin rashes. Now, this, right? Kindly speak a bit louder. Okay, okay. Is my voice clear now? Or should I speak a bit more louder? I hope it's clear now. All right. So, okay. Yes, okay. So the main symptoms would be dizziness, tinnitus, facial edema, skin rash. Now, aspirin acts in our bodies in all sorts of ways. It's not just a localized effect or an effect on a single system. It has a generalized effect. The dizziness and the tinnitus that you see are a response of the irritation of the vestibulocochlear system. All right, aspirin has an effect on the vestibulocochlear system that causes dizziness and tinnitus both at the same time. The facial edema that you're seeing is because of the increased vascularity or the permeability of the vessels due to aspirin. The skin rash is because of an allergic reaction. Aspirin causes degranulation of those mast cells, and that causes a skin rash. Cyanosis has another pathophysiology, dyspnea, flushed skin, and pyrexia. There would be an increased temperature. Cyanosis would be there. Dyspnea is because of the acidic content, the acidic nature of aspirin, because the body is just trying to get rid of the acid. It's going to hyperventilate, and then eventually it would have trouble in breathing, right? Flushed skin is also because of the increased mast cell degranulation of aspirin. Okay, I'm just trying to make sense of all these symptoms to you guys. Dizziness, tinnitus, you won't be able to remember all this if I just read it through. That is why I'm giving you a slight explanation of why is it happening. Why is there dizziness? Why is there tinnitus? It's because of the vestibulocochlear system getting irritated because of aspirin. The edema is because of the increased vessel permeability. The skin rash is because of mast cell degranulation. The dyspnea is because of the rapid breathing to get out as much carbon dioxide as possible, so that the acidic or the pH can be stabilized. All right. The flushed skin is also because of mast cell degranulation. All right. So let's move on. What is wrong with my mood? Okay. So as for the vomiting, as we know that aspirin is highly acidic in nature, it's going to irritate the mucosa or the GI tract, and that would lead to nausea and vomiting. And since it's so much irritative to the mucosal lining, ultimately what will happen, the vessels would get damaged, and there would be massive bleeding leading to hematemesis, which is blood in the vomitus, and melena, which is blood in stools, right? Now, melena does not refer to frank blood, right? Melena is black colored stools, right? Because the blood is from an upper GI source. Whenever you see melena, meaning black stools, just directly correlate it with something that's from the upper GI tract. All right? Why? There's a reason behind it. Whenever blood gets in contact with the strong stomach acids, it oxidizes and it gets that classic black color that we see in the black stools termed as melena, right? So whenever you see the term melena, you should think of an upper GI source of bleeding. If it's going to be a lower GI source, it would be frank blood, not black blood which is mixed within the stools. All right. So now hemorrhage, which is just bleeding from any possible site of the body, nose, eyes, anything. Okay. Why? Because of the low prothrombin levels. Why are there low prothrombin levels with aspirin? As you might already recall, that aspirin inhibits platelet aggregation. It's an anti-clotting drug, right? What it does to the prothrombin time is that it prolongs it, right? And that is why you see this bleeding, right? Okay, so somebody is messaging. Yes, COX inhibitor. Yes, Navera Shoaib. Yes, you're correct. It's a COX inhibitor. Thank you. And then another sign would be hyperventilation. Now, we've already discussed it, that why would a person be hyperventilating? Because his body is in metabolic acidosis. His body is having a high content of acids, which the respiratory system is trying to get rid of in the form of exhaling excess carbon dioxide. Okay, that's how the pH system works, if you guys can recall. I'm sorry, there's someone in the inbox. Antiplatelet and anti-clotting agents different. Well, to be very accurately speaking, yes, they are different. And I'm really sorry about that, because I haven't revised my pharmacology for quite some time now. And you guys are correct that antiplatelets are different and anti-clottings are different. And as for this aspirin, it's a COX inhibitor. So that's how it works. I'm sorry for the wrong information. You guys can correct me at any point. I'm open to criticism. All right. So let's get back to hyperventilation. Why are we hyperventilating? To just get rid of the excess acid that's in our system in the form of aspirin. Okay. Now, what happens when we hyperventilate? You're just getting rid of the excess carbon dioxide more and more and more, and there comes a point that the metabolic acidosis is diminished, and we go into respiratory alkalosis, which means that we have got rid of too much of carbon dioxide, right? And that's disturbing the pH. So I hope this concept of metabolic acidosis and respiratory alkalosis is clear to you guys, because that's quite a big concept that you should be aware of. All right, so aspirin causes severe acidosis. Yes, we know that. And then there would be albuminuria, glycosuria, which are signs of severe kidney damage. Okay. Albuminuria, meaning leaking albumin, which shows that the kidney has been severely damaged, right? And so is the case with glycosuria, meaning the kidney is damaged because of aspirin. And if you want to detect aspirin in the urine, you can do that by just adding a few drops of ferric chloride. This is a chemical, ferric chloride, and it would turn the urine into a violet color. Now, this is pure forensic thing, and probably can come up in your MCQs because if you're a forensic investigator and someone's asking you about how would you know that it's aspirin by just having a urine sample of a postmortem body. So what would you do? You just add some drops of ferric chloride, and if the urine sample turns to a violet color, that means that it was aspirin, right? Now, the fatal dose would be 5 to 10 grams. Don't remember that, not important. And the fatal period is variable, so nothing to talk about there. Let's talk about the treatment now. The first step would be to get it out of the system. And for that, we're going to carry out a gastric lavage. All right, another chat. Okay. So for the gastric lavage, we're going to do it with sodium bicarbonate and warm water. Why sodium bicarbonate? Because aspirin is acidic and we need to neutralize it with something that's basic. Okay, we're going to alkalinize the urine in order to prevent further kidney damage. We're going to do the peritoneal dialysis, hemodialysis. So just basically, we're just trying to get it out of the system as fast as we can, maintain the electrolyte balance, IV fluids, and especially vitamin K for bleeding, and we can even go for platelet transfusion. All right. Then, post-mortem appearance. Rashes. These are very common with aspirin overdose. There might be some aspirin present in the stomach, petechial hemorrhages, and pulmonary edema. Right? And usually the poisoning is accidental. Now, that was it for aspirin. Now, let's talk about paracetamol, right? So, it is one of the most common drugs to be overdosed on because it's used so widely and for almost everything. Now, there are 3 stages of acute poisoning with paracetamol. It includes the gastrointestinal stage, in which you would have a few GI symptoms like nausea, vomiting, stomach pain, and all that. All right. Then there would be a latent phase where you'd feel like that everything's normal. And then there would be a full-blown hepatic failure stage. So it progresses through 3 stages, the paracetamol or the acetaminophen poisoning. So the first stage is deceptively mild. Why are we saying deceptively mild? Because the thing that are going to follow this stage would lead to the death of the possible death of the victim. All right. Now, vomiting is not that severe. The patient might have some nausea, slight epigastric pain. That's it. Nothing more than that. Then there's a latent stage, and in that latent state, I'm sorry. Okay. So the second stage will be the latent stage. It is around after 24 hours or a day has passed after the overdose and the patient's feeling absolutely fine. No pain, no nothing. He might have slight epigastric pain, but not that significant. However, there is an undergoing liver damage that's going on, and that has not yet shown signs in this latent stage. Now, what follows is the most dreaded symptom that can possibly lead to death, which is liver failure. Okay, this can show symptoms like GI bleeding, cerebral edema, renal tubular necrosis, and even cardiomyopathy. right? So the fatal dose is around 20 tablets, and that's not very much, and people can easily overdose it if they're in pain. For treatment, firstly, if there's a suspected overdose, we should monitor the symptoms and we should admit the patient. Gastric lavage should be performed within 4 hours ideally, because if you delay it, then the drug is already within the system now, and there would be no point of performing a gastric lavage because everything's in the blood. All right. So ideally within 4 hours it should be performed, and if there is vomiting, then you should go for fluid supplementation, but you should be very vigilant because you might cause a fluid overload. Now, complications of hepatic necrosis. The main thing that you need to think of acetaminophen is hepatic necrosis. That's it. And it's irreversible. So we need to make every possible effort to treat the patient before it happens. If the patient is in hepatic necrosis, he would have some things like hypoglycemia, metabolic alkalosis, bleeding, cerebral edema. So you need to treat the symptoms. For hypoglycemia, dextrose infusion; for acidosis, bicarb infusions; for bleeding, you can go for vitamin K injections or fresh frozen plasmas; hemodialysis for renal failure; and for cerebral edema, you can infuse hypertonic glucose, right? So the antidote is very important, which is N-acetylcysteine, NAC, NAC. This is the short form of N-acetylcysteine. So this is the most important thing that should be given within 24 hours of the overdose, because after that it won't be as effective, right? So within 24 hours, you should be able to give an acetylcysteine to anyone who has had a paracetamol or acetaminophen overdose. Okay, this is the most important takeaway point, that within 24 hours, you as a doctor should prescribe an acetylcysteine orally. All right. So the post-mortem appearance, the most striking thing would be the hepatic necrosis, followed by renal tubular necrosis, cerebral edema, jaundice, petechial hemorrhage, skin rash. This would be everything superficial, and underlying would be the most prominent hepatic necrosis that we need to look for. Okay, poisoning is accidental mostly. Okay, then the last thing we need to talk about are barbiturates. Okay, these are sedatives. They can be used as hypnotics and even given as an anesthesia drug. All right. Now they can be classified as long-acting, short-acting, and ultra-short-acting. Okay. So let's talk about the overdosage. The main signs and symptoms would include dizziness, ataxia, slurred speech, and short period of confusion followed by coma, right? So these are the most dangerous drugs, and an overdose can cause an irreversible brain damage leading to coma, right? So the face becomes cyanotic, temperature falls, breathing is slowed. There would be liguria, indicating renal damage. There are something called as barbiturate blisters. These are not very common. However, people with overdosage of barbiturates can develop blisters. Death is usually due to respiratory or cardiac failure. If you can recall from your pharmacology, that barbiturates act on centrally on our respiratory centers, so they can cause respiratory failure. And alcohol potentiates the action of barbiturates. So if someone's having the sleeping pill, let's suppose, and he just took a few more because he was very anxious of something, and then he just went to drink, have a cup of alcohol maybe. So he might get an overdosage just because of the alcohol, all right? Because it's going to potentiate the effect of barbiturates. And there was a case in which I don't want to name the college from where that student was, but it was a case and where they were just having some drugs, but probably one of those drugs had some barbiturates, and they were drinking as well. And one of the guy actually died just because of this fact that he took alcohol over barbiturates. All right. So for the treatment, we're going to perform the gastric lavage. Obviously, we just need to get it out of the system. You need to maintain a clear airway with oxygen supplementation, right? Because respiratory failure is the most common cause of death, right? So a patent airway with oxygen, for circulatory depression, you can use something called metaraminol, all right? And if coma is prolonged, you can use something called amphetamine, okay? These are stimulants, CNS stimulants, and can be used to actually stimulate a person's brain, all right? And catheterization would be there. Obviously, he's in coma. For postmortem appearance, you need to look for signs of asphyxia. Why? Because the patient dies from respiratory failure. Frothing at nose and mouth would be there. Residual drug might be there in the stomach. Kidneys would show signs of damage. Deaths are usually accidental from barbiturates or suicidal as well. Okay? That's about it. Thank you so much. Do you guys have any questions? All right, so I hope everything was pretty clear to you guys. So thank you so much for your time, and I hope you learned something. We will call it off now. Can we get the slides? Well, sure you can. But how should I do that? Wait, let me try. And, just a second. I'm trying to get the slides. Okay, so I guess I've sent the slides to you guys in the chat box. I hope everyone can see it. Or okay, wait. It was to, I want to go it to everyone, huh? Achha, please repeat the mode of causing death of aspirin. There's no exact mechanism how aspirin causes death, right? There are multiple things that are involved that can lead to death, right? The patient might bleed to death. He might hyperventilate. He might die from the hepatic failure, right? So there's no exact reason of death. Okay. Okay. So hope everything's clear now. So let's call it off. Thank you so much. Allah Hafiz.